So hello everyone, let me just check, am I audible, is the screen clear, so that we can start the session of the first session of the muscles of forearm. So yes, my dear aspirants, am I audible? So this is a session targeting for the next and the MBBS students so that they can revise the muscles. So many of the diagrams are there to help you understand the muscle attachments, the nerve supply and the action. So in total we will discuss all these details. So myself Dr.Monalisa, MD Anatomy from Forces Medical College Pune. I am here to discuss the muscles of the forearm, and which will be highly beneficial for the students who want to revise the entire forearm front muscle in one go with beautiful and clear diagrams. So my dear aspirants, let's talk about the special class features. When I am talking about the special class feature which is present on the Unacademy platform, it's a interactive session where the learners and the educators can interact. Polls are conducted, learners can participate in the polls and raise your hands, get your doubts clear right itself when the session is going on. So you can have your doubt clearing sessions, you can never miss a session. You can so once you start seeing the session, you will get the notification of the sessions taken and you will be highly beneficial for it. So once the session is finished, you can also download the PDF notes anytime, anywhere, read from the top educators of Unacademy platform. So use the code NAT10 and get an extra 10% discount. And also you can use this code for enrolling in the free sessions of the Unacademy platform. I'd also like to talk about the plus subscription. When I am talking about the plus subscription, all the 19 subjects are completed in a very systematic way. You can access both live and recorded version. You can study from India's top educators. You can compete in live tests and quizzes. You can study on the device of your choice, and you can have an access to 25,000 and more MCQs which is made by the top educators of Unacademy platform. And these are the MCQs which is made on the recent tense of the clinical MCQs of all 19 subjects with a effective explanation given to each and every MCQ. So this is highly beneficial for you. My dear aspirants, go for plus subscription, use my code and get an extra discount of 10%. So as I told you about the plus subscription, you can be the part of well structured course targeting your rank in a better way and a good rank, recorded versions and live sessions, full syllabus and QBank, 25,000 more MCQs and competitive live tests and quizzes. Other than that, when I talk about the prep ladder, so when I talk about the prep ladder, you get the benefits, iconic subscription, you get the benefits of 2 platform, you get the benefits of the plus course of Unacademy, along with it you get the benefits of the prep ladder. Clinical integrated essentials, video lectures from Dream Team, QBank 3, rapid revision snapshots, treasure dream notes of 2021. Congratulations to the toppers of FMGE December session 2021. So I would like to congratulate them, and I would also like to congratulate them, and I wish them best of luck so that they can target their dream rank in the NEET PG examination. So the batches which is right now starting from tomorrow is the Focus FMG batch 2022. Use my code to get an extra discount of 10% in taking the subscription. Mission INICT batch, NEET PG 22 high yield MCQ marathon batch, NEET PG 22 all educator revision batch. Other than that, before that, I would also like to, before starting the session, I would like to show you the slide where the comparison of the plus and iconic subscription has been done. So you can have a comparison of both. You can see the pricing detail. This will help you to make a decision to go for 3 or 4 years of subscription. If you are a student of first, second year, if you are a student of final years or going through internship, you can take just 1 year of subscription and use my code NAT10 to get an extra discount of 10%. So my dear aspirants, let's start with the muscles. So today's topic is the muscles of front of forearm. So before starting with this topic, I want you to tell that muscles of the forearm, when we are talking about muscles of forearm, the muscles of forearm is categorized as a group. We have got superficial group of muscles. So I would like to talk about the muscles which is lying on the front of forearm. Okay. So in this category, yeah, Ravi Kumar, yes, Ravi Kumar. So in this category, we can divide the whole muscles into superficial group. We can divide it into superficial group of muscles. So in this category, we have got following muscles from lateral to medial side. So actually all these muscles will have a common origin from medial epicondyle, and they will be, so you can take your fingers of your hand and you can study by naming the muscles. So okay, so this is how you are going to, so they have got common origin from the medial epicondyle of the humerus, that is common flexor origin. So superficial group of muscles are 5. So we have got 5 in this category as I move from lateral to medial. So the arrangement of muscle as I move from lateral to medial is following muscle: pronator teres muscle, flexor carpi radialis muscle, palmaris longus muscle, flexor digitorum superficialis muscle, and that of flexor carpi ulnaris. So I want to add on one point here. So actually this is superficial group of muscle. If I take the categorization of flexor digitorum superficialis muscle, to be more specific, when we go for dissection, this is exactly the muscle which is located in intermediate level, intermediate layer. This muscle is located in intermediate layer, not exactly in superficial group, but it is intermediate layer or middle layer. And after the dissection and seeing this muscle, we will go on the deeper aspect. There we will find three deep muscles of the flexor muscles of the front of forearm. So let's see the deep muscles of the flexors of forearm. In this category we have got three muscles. These three muscles are flexor digitorum profundus, flexor digitorum profundus muscle, pronator quadratus muscle, and that of flexor pollicis longus muscle, flexor pollicis longus muscle. So these three muscles are the deep muscles of the front of forearm. Okay, yes Ravi Kumar, so yes. Now my dear aspirant, before starting the details of individual muscle, I would like to show you this muscles. So let's see the superficial group of muscles. So in this diagram, let me slightly enlarge it. So yes, I am enlarging this diagram, and here we can see the superficial group of muscle. As I told you, this bony prominence is the medial epicondyle, ME, medial epicondyle of humerus, and this will be lateral part, lateral epicondyle. So now you can see all the superficial group of muscle, all the superficial group of flexor forearm muscle is arising from the common medial epicondyle, common flexor origin. The most lateral one is pronator teres. So you can keep your fingers and then you can understand. So this is the lateral most is the pronator teres. The next is the flexor carpi radialis. This is the first one. This is the flexor carpi radialis. Then we have got the palmaris longus, and we have got the medial one as the flexor carpi ulnaris. Actually this is the fifth one, and this flexor digitorum superficialis, which if you will see the fibers of flexor digitorum superficialis, I would like to use this brown color. So deeper aspect can you see. So only I told you this flexor digitorum superficialis muscle is more basically not lying in the superficial group, but it is lying in the intermediate layer, in the middle layer. Yes, I will take that 100 MCQ session. Okay, so if you see the flexor digitorum superficialis muscle, this flexor digitorum superficialis muscle, if you will see, it is in the intermediate group. It is lying in the intermediate or the middle layer, not exactly in the superficial layer. Is it okay? So this is the fourth one. This is more in the intermediate layer. Now, after the removal or retraction, to see the deeper muscles, we have to retract the superficial flexor muscle, and then we can see the deeper muscles of the flexor forearm. So, before moving to that, I would like to show you this cadaveric image. So, is it okay? Let's move on to this cadaveric image. So, is this diagram clear? So, I would like to appreciate the same thing while showing you this cadaveric image. When you are seeing this cadaveric image, so here you can appreciate the superficial group of muscle. Superficial flexor muscles of the forearm. So, here you can see the muscles. So, you can see the pronator teres muscle. This is the outline. This is the muscle. So, this muscle, this is the pronator teres muscle, which is again as shown arising from the, so this muscle which is exactly, this will be the medial epicondyle, common origin, and other muscles of this group you can see here, the other one. Again I would like to use this brown color to show you this muscle. This is the second one. this muscle, okay, this one, okay. So this is flexor carpi radialis. So this was the first one, this is the flexor carpi radialis, and the thin muscle which you are seeing, the thin muscle here, this thin muscle. So now I will use a highlighter so that, now, okay, see here, this thin muscle which you are seeing, this one, this is the palmaris longus muscle, this is the third one, this outline, this is the palmaris longus muscle, and the most medial most muscle, the most medial most muscle which I want you to show, this one, this muscle is the flexor carpi ulnaris. So this is the fourth one, okay. So these muscles are seen. So very nicely you can appreciate the flexor forearm muscle, the superficial group. Now why we can't see the flexor digitorum superficialis? Because flexor digitorum superficialis will be lying on the more lateral aspect. Don't get confused with brachioradialis. This is the muscle of extensor group. This is the muscle of extensor group, not the flexor group. It is mainly on the lateral aspect, posterolateral aspect, and this is the muscle of extensor group. The muscles in this cadaveric image, as we move from lateral to medial, the muscles are, the most lateral most is the pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. FDS, which is also considered to be the muscle of superficial group, is lying in the intermediate level. Now let's talk about the muscles of the front of forearm, the deeper aspect. So what I told you, let's talk about the muscles of the front of forearm, the deep group of muscle. Deep group of muscles. So in this category we have got just 3 muscles. So the most 3 muscles which is shown here is the flexor digitorum profundus, flexor pollicis longus, and this quadrilateral muscle, quadrangular muscle, that is pronator teres. So these 3 muscles, pronator quadratus, it's the pronator quadratus, flexor pollicis longus, and that of flexor digitorum profundus are the 3 muscles of the deeper aspect. These 3 muscles are of the deep flexor group of forearm muscle. Now let's see this image where I am again highlighting, enlarging this. So if I am enlarging it, so I will enlarge this cadaveric image, and here you can see superficial flexor muscles. What I told you, to see the deep muscles of the flexor group of forearm, we have to retract the muscle. Which retraction is done? So retraction of the superficial flexor muscle has been done, and thereafter very nicely you can appreciate the muscles. So the muscles are flexor pollicis longus muscle. This muscle outline which you are seeing here, this muscle, this is the flexor. This muscle which you are seeing here is the flexor pollicis longus muscle. Other than that, the big bulky muscle which you are seeing, this tendons and all, this big bulky muscle, this is the second one. This is the flexor digitorum profundus muscle. And the one which will be lying on the deeper aspect, it is actually quadrilateral in shape, and you have to retract the flexor pollicis longus and flexor digitorum profundus to see the muscle lying in the deeper aspect or the lower aspect of the radius and ulna anterior aspect, that is the pronator quadratus muscle. So done. So now you can see here, this is another diagram which I want you to see. Here the flexor digitorum muscle has been retracted. So now flexor digitorum muscle has been retracted, and in the deeper aspect, the quadrilateral shape muscle which you are seeing very nicely, this quadrilateral shape muscle, the outline can be shown here, and this quadrilateral muscle is pronator. So this was the third one on the deeper aspect, pronator quadratus muscle. Palmaris longus muscle is the superficial group of muscle, my dear aspirant. Palmaris longus muscle is the superficial group of muscle. So that already I have shown you, Ravi Kumar, you can see also here. See here, this thin tendon like muscle. Here you can see this is the superficial group of muscle which I am showing you. And here the thin tendon like muscle, this tendon like muscle which you are seeing. Okay, this is the palmaris longus muscle. Individually I am going to show you. So don't worry, individually I am going to show you the details of each individual muscle. So my dear aspirants, we have done with the whole muscle as together, and now let me explain you the individual muscle. So let's start with the first one, that is pronator teres muscle. The first muscle, that is pronator teres muscle. So see here, the pronator teres muscle has been shown in the diagram, and you can see actually this is the smallest superficial flexor muscle. Pronator teres muscle is the smallest superficial flexor group of muscle, pronator teres muscle. This is the smallest superficial group of muscle. So here you can see this is the humerus bone, and it is arising from, if I talk about origin, which can be clearly seen in this image, you can see here it is having two heads of origin. This is one head and this is the other head of origin. So it is having two heads of origin, and it is inserting here in the radius bone. So here this is the humerus bone. If you want, I can have an enlarged view. This is the humerus bone, this is the ulnar bone, and this is the radius bone. So what you can appreciate, the origin is by two head. Okay, the origin is by two heads. Okay, so it is having one of its origin from the common flexor origin. Common flexor origin. What is common flexor origin? The common flexor origin is from medial epicondyle of humerus. Medial epicondyle of humerus bone. This is also called as humeral head. This is also called as superficial or humeral head. The other origin is called as ulnar head. Ulnar head, which is also called as deep head, and humeral head is also called as superficial head. Okay, so as you can see, the deep head is originating from ulna, which is clearly seen. Vijay Verma, good evening dear Vijay Verma, good evening. So you can clearly see the ulnar head, that is the deep head, is originating from ulna bone. To be more specific, medial margin of coronoid process of ulna. Medial margin of coronoid process of ulna. So after this we have done with the origin. So here we have already done with the origin. We have done with the humeral head origin, and we have seen the ulnar head of origin. Okay, these two heads. Now, yes dear. Yeah, so Mr. Ravi Kumar, yes, I got your point that you want only MCQs and quick. So actually we have got, I would like to clear that. So Mr. Ravi Kumar, actually we have got Let's Crack NEET PG platform. We have got Unacademy platform where there is quick revision and MCQ sessions going on. But on that platform, this is the platform which is called as Unacademy Future Doctor. Unacademy Future Doctor is dedicated for first year and second year students. So this channel is basically for theory part. In addition to it, it is also having MCQ session. If you want to have a quick recap and a quick session, your suggestion is appreciated, Mr. Ravi Kumar. But if you want MCQ session and a quick session, you can join me for that on the Unacademy special classes and Let's Crack NEET PG. So whenever you will see the session of Let's Crack NEET PG, it will have more of MCQ sessions and targeting for competitive exam. But this channel, that is Unacademy Future Doctor, is dedicated for the students of first year, okay, first year, second year students. So they want the theory part also. So that is the point, I go with theory part in this Future Doctor. But when it comes to Let's Crack NEET PG or the Unacademy special classes and plus classes, we go in a faster way. We go with the MCQ sessions and we target the competitive exam. But this is the conceptual study, so we want to study in more detail. Okay, that is the difference. So that is the difference of channel. Okay, so my few hours I dedicate to Future Doctor and few hours for the competitive examination. So if you will see the insertion point, okay, so if I talk about the insertion point, the insertion, you can highly appreciate that insertion is occurring. The insertion of this muscle is taking place on which bone? It is inserting into radius bone. So it is inserting into middle 1/3 of the lateral aspect or the most convex part of the middle 1/3 of radius bone. So this is the insertion. This is the insertion. Got it? Yes. Now, thank you Mr. Ravi. Thank you. So we have done with this. Another important point which I want you to tell, can you see this image? This is median nerve, and you can see here median nerve is giving innervation to the pronator teres muscle. One of the important point which I want you to see here, that median nerve is traversing between the two heads of pronator teres. Just now we have seen that the pronator teres muscle is having two heads of origin. One is called as the humeral head and the other is called as the ulnar head. In between the two heads of pronator teres, the nerve which is traversing is median nerve. So at times the median nerve can be compressed between two heads of pronator teres, and that condition is called as pronator teres syndrome. Nerve supply, median nerve. What is the action, dear? What is the action of pronator teres muscle? It causes pronation of forearm. It is the pronators of forearm. It causes pronators of the forearm. Okay. Now let's see the other one. So we have got two other muscle. We have got flexor carpi radialis and we have got flexor carpi ulnaris. So if I talk about flexor carpi radialis and flexor carpi ulnaris, so let's see in a single image. Let me just enlarge this image. The two muscles has been highlighted here. Okay. Now if I talk about FCR muscle, you can appreciate that the origin is from, again the origin is from medial epicondyle. So you can see here the origin of FCR is only from medial epicondyle of humerus. I am writing in short. Is it okay? It is from the common flexor origin. If I talk about flexor carpi radialis, it is from common flexor origin. And if I talk about insertion, the insertion is onto the, as you can see here, this is the second metacarpal bone. Okay. So insertion, if you will see the insertion point, see here. If we talk about its tendons and it is getting inserted, so exactly it is inserted onto the second metacarpal bone. So insertion is onto the base of second metacarpal bone on the palmar aspect. Okay. Now let's see the other one, that is flexor carpi ulnaris. So when I am talking about flexor carpi ulnaris muscle, you can see here the origin is, so if I talk about flexor carpi ulnaris, the origin is seen, it is also originating from medial epicondyle of humerus, that is common flexor origin. And other than that, flexor carpi ulnaris also originates from olecranon process of ulna, and by aponeurosis of the posterior, it also originates from the aponeurosis of posterior border of ulna. Okay. Now, if you see the insertion, see here, I am talking about insertion. So, can you see the flexor carpi ulnaris muscle in this diagram? You can see it is bifurcating and then inserting. Flexor carpi ulnaris is inserting, as you can see in the diagram, going towards the bone. So, it is going towards the pisiform bone, it is going towards the hook of hamate, and it is going towards the base of fifth metacarpal bone. Okay. So, here clearly you can see, if I just remove it, you can see the tendons of flexor carpi ulnaris is going towards the medial carpal bone and the base of fifth metacarpal. So, this is the insertion point. So, insertion. So, let's talk about the insertion. If I talk about the insertion of FCU, it is inserting on following bones. It is inserting into the pisiform carpal bone, it is inserting into the hook of hamate, it is inserting into base of fifth metacarpal bone. Base of fifth metacarpal bone. Done? Base of fifth metacarpal bone. Done with this? Yes. So, we have done with the origin insertion of these two muscles. Now, what remains is the action. So, what remains is the action. Flexor carpi radialis and that of flexor carpi ulnaris. So, if we talk about flexor carpi radialis and that of flexor carpi ulnaris, we have to talk about its action. So, when the flexor carpi radialis is acting along with the flexor carpi ulnaris, so basically it is causing flexion of wrist. It is causing flexion of wrist. Okay. Other than that, when the flexor carpi ulnaris act along with FCU, it is causing flexion of wrist, and when flexor carpi ulnaris is acting along with extensor carpi radialis, longus and brevis, it will cause abduction of wrist. It will cause which action? It will cause abduction of wrist. So, done with FCR, now comes the action of FCU. So FCU. When I am talking about flexor carpi ulnaris, when we are talking about flexor carpi ulnaris, it when acts along with ECU. What is ECU? Extensor carpi ulnaris. It will cause adduction of wrist. It will cause adduction of wrist, and along with FCR, it causes flexion of wrist. So see here, we have done with the action of both the muscle, and if I talk about the nerve supply, FCR is getting innervation from median nerve, FCU is getting innervation from ulnar nerve. So we have done with this. Now let's move on to the next, that is palmaris longus muscle. So one of the student was asking about palmaris longus muscle in the previous time. I told you I will show you a diagram. So see here, this diagram is clearly helping you to understand the origin insertion. So very nicely you can appreciate this part is the origin, and from here it is then going and is thinning and then again attaching with the aponeurosis. So see here. So this is the whole extent of this muscle, that is palmaris longus muscle. So in this diagram itself you can say the origin. So this is the origin point. So from seeing this diagram it is clear to you the origin is from medial epicondyle of humerus. That means common. That means palmaris longus muscle is having a common origin from medial epicondyle of humerus. Common flexor origin. Common flexor origin. Okay. When I talk about the insertion, what you can see lower down it will form a long cord-like structure. It forms a long cord-like structure, and thereafter what happens, it attaches and crosses. Actually thereafter it will go and cross superficial to flexor retaniculum. It will cross superficial to flexor retaniculum, which we have discussed in the previous session. Superficial to that of flexor retaniculum. And then it joins palmar aponeurosis. It joins palmar aponeurosis of the hand. So this is about its origin insertion. Now moving with the palmaris longus muscle. Palmaris longus muscle, action and nerve supply. So nerve supply is again by median nerve. Actually all the muscles, flexor muscles are getting innervation from median nerve. Most of it, only FCU and medial part of flexor digitorum profundus is from the ulnar nerve. Rest all muscle from the median nerve. So I will write in detail at the end. So palmaris longus muscle, action. Actually it is causing the flexion of wrist and also involved in making the palmar aponeurosis tense, making palmar aponeurosis tense. Okay, making palmar aponeurosis tense. Okay. So my dear aspirants, now I would like to show you this cadaveric image. Here I want to, so one of the student has asked me also, so I want to appreciate this. Can you see this is the palmar aponeurosis. This is the palmaris longus muscle, and here you can appreciate nicely that this is the tendon of it going towards the wrist flexor retaniculum, and then it is merging here with the palmar aponeurosis. So see here. Here this structure is palmar aponeurosis is merged with the palmar aponeurosis, and this muscle which you are seeing tendon like is the whole palmaris longus muscle. So very clearly in this diagram I have highlighted in green color the tendon like structure, a degenerating muscles of the forearm flexor group palmaris longus muscle, which is forming a tendon in the middle and then merging and joining the palmar aponeurosis. So is it clear? Is it clear? So yes, done with this cadaveric image. Now let's move on to the next one, that is flexor digitorum superficialis muscle. So if I talk about flexor digitorum superficialis muscle, it's the largest superficial flexor group of muscle which is exactly lying in the intermediate plane. It is not a superficial group, but it is lying in intermediate plane It is lying in intermediate plane of the flexor muscle, and here you can appreciate that flexor digitorum superficialis muscle. If I enlarge it, it is originating from, again one of the origin point is similar, that is ME, that is medial epicondyle of humerus. Other than that, you can see it is originating from the other bones also. Actually not only medial epicondyle, it is originating from the medial aspect of coronoid process of ulna, from the elbow ligament, and these are the common origin, and thereafter lower down you can see its tendons are dividing, and it forms the tendon which is inserting till the level. It is diverging as two diverging point. It is diverging and getting attached to that of middle phalanx of the digits, It is bifurcating and then attached to the middle phalanx of the digit. Clear? So that means we have done, that means after that I would like to write the details. That means flexor digitorum superficialis muscle, origin, it is having two heads of origin. One head is humero-ulnar head. The humero-ulnar head is originating from medial epicondyle, common flexor origin of the flexor group of muscle. Other than that, it also originates from coronoid process of ulna. To be more specific, medial margin of the coronoid process of ulna, and other than that, it also originates from the ulnar collateral ligament of elbow joint. Got it, my dear aspirants? So these are the points of origin, that is of the humero-ulnar head. Now, I also told you that this is the other bone, that is radius bone, and it also originates from the radius bone. So the other head is, write down. So we have done with the humero-ulnar head. The other head is called as radial head, and radial head of flexor digitorum superficialis muscle originates from the area above anterior oblique line of radius, upper half of the anterior border of radius, you can say upper half of the anterior border of radius. So you can see here it is having two heads of origin, and when I told you the insertion, see here. So you can see here the same thing I have written here also in this diagram. You can see here humero-ulnar head from medial epicondyle and the medial collateral coronoid process and anterior oblique line of the radius. Now, why I am showing you this diagram? Okay. Now, what you are seeing here, when you will see this diagram, what you can see here, that at the insertion point, this is the two tendons diverges, and here very clearly see, you can see here it is inserting into the middle phalanx of the digits, It is inserting into the middle phalanx of the digit, clearly. So we have done with this. Now let's move on to the action and the nerve supply of flexor digitorum superficialis muscle. So FDS, write down FDS muscle, that is the FDS muscle, that means the action of the muscle and that of the nerve supply. The nerve supply is median nerve, and when I am talking about the action, this muscle is flexor digitorum superficialis flexes the proximal interphalangeal joint of the medial foredigit. Why? Because it is inserting onto the medial foredigit at the middle phalanx. It is inserting onto the medial four digits. It is inserting into the medial four digits on the middle phalanx, and this is the action which is done by this. Okay. Now, also it also causes the flexion of proximal phalanx and the wrist joint. It also causes wrist joint flexion. So these are the actions. It also causes wrist joint flexions. So these are the actions of the flexor digitorum superficialis. So my dear aspirants, with this we have finished the whole of the flexor group of muscles, superficial group of muscle. Now I want to move with the discussion of deep group of muscles of the flexor aspect. So in this I will want to firstly go with the flexor digitorum profundus muscle. So firstly let me okay, so flexor digitorum profundus. So if you will enlarge this diagram, what you can see, the flexor digitorum profundus muscle. Here you can see this is the ulnar bone and this is the radius bone. So this flexor digitorum profundus muscle, this flexor digitorum profundus muscle, or it's the most bulky muscle, and it is originating from, as you can see, it is originating from upper 3/4 of anterior and the medial surface of shaft of ulna, and also from the adjacent intraosseous membrane. I am for the intraosseous membrane. So we know that intraosseous membrane is connecting the forearm bones, radius and ulna. So also from the intraosseous membrane, and also from the aponeurosis of the posterior border of ulna. So along with the aponeurosis of posterior border of ulna, it originates along with FCU plus extensor carpi ulnaris. So these are the points of origin. So it originates from upper 3/4 of the medial anterior surface of the shaft of ulna, adjoining part of the intraosseous membrane, and aponeurosis, common aponeurosis of the posterior border of ulna, from which flexor carpi ulnaris and extensor carpi ulnaris also originate. From here the muscle is inserting, and if you can see this diagram very nicely, you can appreciate the tendons of the deeper muscle. It is going till the level of distal phalanx. So you can see here it is going till the level. Insertion is occurring in the distal phalanx of. So it is inserting into the distal. It forms 4 tendons which enters the palm deep to flexor retaniculum, and it will insert into the distal phalanx of medial forefingers. Okay, so write down the insertion. Dr. Kaustubh, yeah, welcome to the session, dear. Okay, I will give you the information of my upcoming session. So actually this is the theory class which I am taking. So insertion. Let's talk about insertion. So if you have missed out this session, also go through. This is very useful. I have included many of the cadaveric images, many good diagrams to understand the muscle origin and insertion, because in image based MCQ also you want to identify the muscle. So you want to see the relevant images. Insertion. Insertion of FDP, flexor digitorum profundus inserts. The muscle forms 4 tendons which enters the palm. It enters the palm, forms 4 tendons which enters the palm deep to flexor retaniculum and inserts. It passes between the 2 slips. Actually flexor digitorum profundus tendon passes between the 2 slips of flexor digitorum superficialis, and it will insert onto the distal phalanx of medial forefingers. Done? Got it? Now if I talk about its nerve supply, the nerve supply is by the, it is an example of hybrid muscle. So lateral part is by median nerve deep branch, and we know that deep branch of median nerve is anterior intraosseous nerve. It is by anterior intraosseous nerve, that is the deep branch of median nerve. And if I talk about its medial part, the medial part is getting innervation from ulnar nerve. Okay, I will also talk about its action. Before that, I want you to show this image. So this image will help you to understand the concept. So see here, when you see the tendon of flexor digitorum superficialis, so what you can appreciate, that flexor digitorum superficialis at the level of proximal phalanx divides into 2 slips. See here, it divides into 2 slips and inserts on M for middle phalanx. Okay, and in between the 2 slips of, you can see here, in between the 2 slips, here you can appreciate in between the 2 slips of flexor digitorum superficially, the tendons of flexor digitorum profundus passes and it is inserting into the distal phalanx. It is inserting into distal phalanx, that is the FDP, passing between the two slips of flexor digitorum profundus. This is the inserting into middle phalanx. Actually, this is very beautifully seen when we go for dissection also. This is very beautifully seen. So, done with this. Now, I want you to appreciate the same thing by showing you this image. So, this is a cadaveric image in which you can appreciate the same thing. Now, in this diagram, okay, let me show you. So, the two tendons, so here FDS and FDP tendons will be appreciated. So, you can see here that these two tendons, both the tendons of flexor digitorum superficialis and flexor digitorum profundus is having a common covering of flexor fibrous sheath, and you can see the two slips. You can see the two slips which is shown here is the splitting of the two slips of flexor digitorum superficialis. So, you can see here the two slips of flexor digitorum superficialis has divided here, as you can see here. Okay, and in between these two slips, the muscle which is running in between these two slips and going till the level. So, this tendon you can see going till the level of distal, So, see here, this is passing between these two slips. This is cadaveric image all in one at a time. You keep, ma'am, in one session. So, sure, we will do that. Okay, I will do that. So, I just want to make you understand, this is the slips of the tendons of the two slips of FDS which is gapping, and in between this will pass the FDS tendon, FDP, which will be inserting into the distal phalanx. Now, so yes, so done with this, and now FDP action. If I talk about the action, it flexes, it causes the flexion of distal phalanx at its interphalangeal joint of the medial four fingers, medial four digits. Also helps in flexion of wrist. So done with this. Now we have got two more muscles. Quickly I want to cover it. Flexor pollicis longus muscle. The flexor pollicis longus muscle. Let me enlarge it. See here. So this is the radius muscle. This is the radius bone, as you can see here. And here you can see here this muscle which you are seeing here is arising here, and this tendon, this is forming a tendon, and this tendon is going till the level of, as you can see, it is going towards the level of distal phalanx of thumb. So, if you will see flexor pollicis longus muscle, its origin is from the radius bone, and it is originating from the upper 2/3 of the radius bone below the line of, so it is originating from radius bone. Okay, so it also is originating from, if you will see, it is originating from the radius bone below the anterior oblique line. Okay, below the anterior oblique line, and it is inserting into the distal phalanx of the thumb. So, see here, let's write down FPL tendon. Yes, sure, Ravi Prakash. Firstly, I am going with the general understanding, and then we can correlate with the clinical aspects. Don't worry, clinical sessions will be, many clinical sessions are there. You can join me. Firstly, we have to cover the gross part, and then we will cover up the clinical aspects. So, cadaveric images, clinical aspects, I will take subsequent sessions. Don't worry. Flexor pollicis longus. So, when I talk about flexor pollicis longus, its origin, as we have seen in the diagram, it originates from upper 2/3 of anterior surface of radius below anterior oblique line, below the anterior oblique line which lies in the radius bone, and also adjoining part of intraosseous membrane. Also from the adjoining part of intraosseous membrane it originates. And if I talk about its insertion, so it is inserting. If I talk about its insertion, it is inserting where? If I talk about insertion, it is inserting, as just in the diagram we have seen, it is inserting at the base of distal phalanx of thumb. Distal phalanx of thumb. Now, The nerve supply. So deep muscles of the flexor group of forearm is getting its innervation from deep branch of median nerve. So the nerve supply will be anterior interosseous nerve. That is the deep branch of median nerve, anterior interosseous nerve, and the action will be it flexes the distal phalanx. It causes the flexion of distal phalanx of thumb. Flexes the distal phalanx of the thumb, and along with it also causes the flexion of first metacarpophalangeal joint, first carpometacarpal joint. So it is causing the flexion of distal phalanx of thumb, distal interphalangeal joint of the thumb, and also the first metacarpophalangeal joint of the thumb and carpometacarpal joint of the thumb. So causing the flexion of the thumb. Okay, now let me come up with the third muscle of this deeper aspect. That muscle is pronator quadratus. Very nicely we can appreciate the whole outline of the muscle is also quadrilateral in shape, as you can see in this diagram. So if I talk about its origin, it is originating from ulnar bone. So it originates from ulnar bone and it inserts into the radius bone. It inserts into the radius bone. So it originates from the oblique ridge of the lower 1/4 of the anterior aspect of the ulna, and if you will see, it is inserting into radius bone. So inserting into radius bone, which part? Anterior border and the anterior lower part, anterior surface, to be more specific, 1/4 lower part of the anterior surface of the radius bone. So it is passing from ulna to that of radius bone. Its nerve supply, again as I told you, nerve supply of all deep muscles of the forearm flexor group is by anterior interosseous nerve. Anterior interosseous nerve. And action is, it is also causing pronation of forearm. Both pronator quadratus and pronator teres muscle together is involved in pronation of forearm. An important action, that is pronation of forearm. Okay, my dear aspirants, so now I want you to give information, like today is Tuesday, but starting, so tomorrow is Wednesday. So Wednesday will be continuing the session of special class and YouTube, which will be continuing like clinical cases. So I will take on Wednesday clinical cases MCQs. Clinical cases MCQs will be taken on the YouTube Let's Crack NEET PG, Let's Crack NEET PG platform. Okay. And completing the second part of forearm muscle, that will be extensor group of muscle. So in that case, again I will be live at 8 p.m. on the Future Doctor Unacademy group. In the Future Doctor, that is Unacademy Future Doctor, the same YouTube. Now special class will be, on the special class will be 6 p.m. session. So 6 p.m. session will be the special class. So clinical cases 7 p.m. session on Let's Crack NEET PG, extensor muscle 8 p.m. 6 p.m. will be the special class on Unacademy platform. This will be on the Unacademy platform. This is for tomorrow. But as I told you, this is for tomorrow. But as I told you, this is for tomorrow's session, Wednesday. But on Thursday, Friday and Saturday, 3 days, I will cover up 100 MCQs, most important MCQs on the recent pattern of examination, targeting a better rank for the NEET PG 2022. NEET PG 2022 examination, the sessions timetable and the link will be provided on the Let's Crack NEET PG platform on the Unacademy Telegram group. So you can have the details, link of the session. This will be taken on the special class and also on the YouTube session. 6-7 sessions I will take, 40 minutes each, and we will cover up 100 MCQs of anatomy, all a mixed bundle of cadaveric image MCQ, a mixed bundle of clinical MCQs, and gross anatomy and embryology and histology MCQs. I wish you best of luck. And I want everyone to join by using the code ANAT, and those who have not joined the Unacademy platform till now, please join it by using the code ANAT and enroll in the free sessions of the Unacademy. So you can enroll in this free session by using the code ANAT, and this will be highly beneficial for you. My dear aspirants, before ending the session, I would like to show you this detail. In this detail, you can have a comparison of Plus and Iconic group. The pricing detail has been shown to you. By using the code ANAT10, you can get an extra discount of 10%. This will be highly beneficial. Do present in the session live, and all the best. Keep studying. Thank you so much for being present live. And also, my dear aspirants, all the best. Target your goals, and we together will crack the examination. And my dear aspirants, do like, subscribe Unacademy Future Doctors, attend the session on the special class, download the PDF notes, which is highly beneficial for you. So Wednesday, 2 sessions on the YouTube, 1 session 6 p.m. on the Unacademy, Thursday, Friday, Saturday, 100 MCQ session. All the best, be connected. Thank you so much. Thanks, my dear aspirants. Thanks. Let's get connected tomorrow. Thank you.